It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Pelesuji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Well, good morning. Thanks for tuning in here on this Monday morning. Good to be back here after taking a week off. So good to see you, Yanji. I'm Ryan Pelesuji. This is Spotlight Hawaii, of course, on the digital platforms of the Honolulu Star-Advertiser. This morning, we are shining a spotlight on a subject that we've talked about multiple times on this program, and we're joined by someone who is very intimately involved with this issue.
That's right. We are focusing today on homelessness in Hawaii. A lot has changed throughout the pandemic in terms of the demographics of who is on the street and who is the most vulnerable. So we are going to be speaking today with the executive director of the Institute for Human Services, Connie Mitchell. She joins us from her office now. Connie, thanks for being here.
Aloha. Great to be here with y'all.
So let's talk about those demographics. You know, we spoke with you early on in the pandemic about who you were concerned about, who you thought could be most at risk, when all of the economic hardship was brought on by all of those lockdowns. What have you seen change throughout the pandemic, and who really is homeless now?
Well, I think, we saw unsheltered people on the street go up, definitely more people there. The people who were in shelters, those numbers went down. And so it's just something significant because they kind of balance each other out when we talk about homeless numbers in general. But, I think I mentioned before, unsheltered people went up 9.7% in the last, I would say the last 10 years or so, or since 2018, I'm sorry. So I think we really need to kind of frame that and say, if people say the homeless numbers have stayed level, but you see so many more people, on the street, it definitely is true. There are more people on the street. So that's number one. We have seen a lot more people who have been aging out, unfortunately. So the numbers of seniors that we're seeing becoming homeless has been going up as well. And during COVID, that was particularly something that we wanted to pay more attention to because seniors were so much more vulnerable. But just to answer the question too of, what we saw happen, during COVID, we were very frightened by the fact that, well, what are we going to see, with people not having access to the testing, to the vaccinations. But in fact, the homeless services community came together, and Project Vision Hawaii was a outstanding partner in just really making sure that people were tested, people were given the vaccines when they wanted to have them. And so we actually came out of it fairly okay. We didn't have like this mass, decimation of our population like I thought we might, because I don't know if you guys remember, but we had to even close down our men's shelter, at one time, in fact, a couple of times, and, become quarantine places. But I think everyone pulling together just made a huge difference.
Let's talk a little bit about the shelters, because that ties into the numbers and what we're seeing now, and also what happened during COVID. Have all those shelters reopened? Why are we seeing maybe some of those differences in the numbers? And are those shelters able to support all the needs that we have right now?
Well, I think, what was really wonderful was that the Honolulu Police Department had opened the Honu. It was called the Post at first, where it was an outdoor shelter, when COVID first began. And I can't tell you how grateful I am for that partnership, because it allowed some people to just go to a place where they could quarantine for the first 14 days. You remember those days where everybody had to quarantine for a bit? And, for homeless people, there was nowhere for them to do that. And, we couldn't bring them into the shelter because we were full, and we were actually decanting the shelters, trying to decrease the population because people were so tightly packed into shelters. So we had to decrease the numbers that we served during that time. So it really was wonderful to have the outdoor shelter available. That has evolved. And so the Honu, as it's known today, is a little bit smaller, and it's moving, from one place to another. It's a mobile shelter, so that's what it's supposed to do. But it does take overflow, but I think overall we've lost numbers of shelter beds, we have. And so I don't think we're back up to where we were maybe pre-pandemic, but we're hanging in there, and just trying to accommodate. One thing I did want to say is that we are seeing more people that are coming from out of state, to be here, and, they're becoming homeless in the count as well. So we do everything we can, to encourage them not to come in the first place, or, to help them return, if they are here and they feel stuck here.
Let's talk about, with the previous administration, the Ige administration, when they left office, they touted a lot of their accomplishments. One of the things they really touted was a decrease in the number of families that are homeless. So when we look at the numbers, you said that, sort of as a raw number, it sort of stayed steady, but the demographics have shifted a bit. What are you seeing there, in terms of helping families and getting them off the street, but then who is now becoming homeless?
I think when we decided to prioritize families with children, to get them off the street, I think the service providers did an awesome job. We linked hands and really tried to connect up, the housing piece with the outreach piece and the shelter piece. So we were able to decrease homelessness among families, something like 57% or so, which is, really phenomenal. And I think, and as much as they're taken off the street, there are other people that are ending up on the street more, or they're, becoming a lot bigger portion of the people that we see. So we are seeing, and I think the public sees, people who are mentally ill, people who have substance abuse issues. And then, we also have people who are aging, who are chronically homeless, a lot of medical disabilities as well, which is just really tragic, because when people don't have access, where they're homeless, they have less access, to a lot of healthcare. And we're just trying our best, with a lot of other service providers to change that. I think some of you have heard about CORE, the city's, program that really is trying to address the folks who have those medical problems particularly.
Yeah, I want to stay there a little and talk more about CORE. Your thoughts on how this new program being rolled out by the Blangiardi administration has been effective thus far, and what do you think needs to continue to happen to have more of a significant impact? We know that there has been a little slower start than maybe some would have hoped for this program, but what is your overall thought on how things have done and where things are going right now?
I think CORE is a great addition, to the spectrum of services that are available for homeless individuals. I think they have been wonderful to help get people where they need to go. They have those ambulances, the converted ambulances that really help transport, and they certainly have the manpower relative to people who are in the know medically, and so they are able to help people get to the emergency room, or they need to get to other services. I think we could probably work a lot more on collaborative relationships and collaboration between having them have places to go, like shelter. I think they feel the need for more shelter beds, so I certainly feel like we can as a system develop more shelter beds, and that would really help. And not just any kind of shelter bed, but shelter beds that can take people who have different layers of complexity, people who are affected by substance use disorders, as well as mental illness, and also the medical disabilities and medical vulnerabilities.
Let's talk about that mental health piece, because that is so crucial, and it's something that we see all the time in our community. I'm interested to know about the Outreach Navigation Program, just if you could familiarize our viewers with what that program is, what it does. I understand that it's ending its funding this summer, so what you'll be asking the legislature for when it comes to supporting a new round of that program.
Sure, thanks, Yunji. Actually, it's funded by the city, for us right now. And it's been a wonderful program. And the goal of this program is specifically to help people access treatment. People who maybe are so mentally ill that they really don't know they're even mentally ill, and they really need medication. And some people who also have dually mental illness and substance abuse issues, which we see often on the street as well. So what our team does specifically is to take referrals from the police, from other outreach agencies, or our own outreach team, of people who they feel fit the category of folks that really need maybe legal intervention, to help order treatment for them. But, the first thing we do is just really do some assertive outreach with people. We engage them. We find out, where they're at. We develop a relationship. And more than 50% of the people that we've gotten on medications, and I'm not just talking about just giving them pills. These are long-acting injectable medications for psychosis. Over 50% of them have been through just developing the relationship and convincing them to try it. And when they try it, and they start to get better, they realize, oh, wow, this isn't that bad. And it's almost like an awakening for a lot of people. So, we go from assertive outreach to then considering if they have a family member that might be a guardian for them, we would apply for guardianship. Or finally, if there is no one like that, we would maybe petition for the court to order the treatment for the person, including some of these injectable medications that last 30 days or even longer in some cases.
I want to circle back to something that you just mentioned about those those of the homeless population that are traveling to Hawaii and finding themselves there. I mean, this for sometime in the past was maybe an urban myth that states were flying people in, and that maybe not be the case here, where other states or cities are flying people to Hawaii. But you did say that there are others who are coming here hoping to find some sort of support or make Hawaii their home, also recognizing though that they might not have the means to live in a home themselves. How are you reaching out to them or these communities prior to them even getting on a plane? And what are the efforts being made right now to ensure that they can be sent back? We know that there are programs that are still in existence like that, but what is, I guess, being more done to help those who are coming to Hawaii so that our resources can focus on those who actually are from Hawaii?
I think among homeless service providers, we have an understanding that, we don't want to encourage anyone, to come to Hawaii because we have enough homelessness here. We still remain one of the highest, rates of homelessness in the country, behind New York and DC, I think. But, as far as numbers go, of course, we're a smaller, state, and there's smaller numbers, but we still have high rates. So we tell people whenever they call, because some people, they kind of have the idea that they can reserve a bed in our shelter when they call. And I just, we tell them, I'm sorry, but we don't do that. And if you come, there is no guarantee that there will be a bed for you, if you land here. And that is the same kind of script that we have other people sharing with people who are calling. We have veterans that are flying here. We have families that are flying here. And part of it is, you're right. It's an urban myth that there's government, that is sending them here, but there are family members, and they have, sometimes disability checks that allow them to purchase a one-way ticket here very easily. And so many of them decide, well, I don't like it here where I am, on the mainland, and then they'll decide to try it here in Hawaii. When they get here, a lot of times we find them because we cover the resort area in Waikiki, and they like to, of course, go and visit Waikiki. So in those service fairs and the outreach that we do there, and our partnership with the Waikiki Business Improvement District, they have an ambassadors program where they identify some people like that and they make referrals. We're able to reach them, offer them the opportunity to go back if they would like. If they're willing to pay for 50% of their ticket, we can send them back. And so sometimes their family members, will help pay for them to go back because they realize that that was a really bad move, on their part. I do want to say something, Ryan, that during the COVID pandemic, we did not have too many people coming because the airlines were shut down. And as soon as the airlines started opening up is when we started to see more. And we have seen a lot more people recently who are recent arrivals, in Hawaii. And because of our area that we cover in Waikiki and also our location near the airport, we do see more people coming directly to us.
Wow, that is very troubling. I want to go back to the outreach navigation program. If you could just share some numbers with us. This is, again, administering long-acting, oftentimes, schizophrenic drugs or to suppress schizophrenia or to get people more mentally balanced. How is the success of that program? How expensive is this program? And what do you need when the funding runs out in June? Is that something that you go to the ledge then for? I know you said the city is funding it now. Where will the next sort of tranche of money, if there is any, come from to support this program?
I think, first of all, we would really like to have the program, refunded, so that we can continue the work that we've done. In just the last 14, 15 months, I would say, we've gotten about 40 plus people on medications. And as I said, over half of those people were from assertive outreach, but we certainly have done in the remaining 18 to 20, half of them are what we call assisted community treatment, or ACT, or assisted outpatient treatment, which is court ordered, or a petition for guardianship, which again requires some legal assistance. And in those cases, we've helped some families become guardians, and really that has helped a lot, because if the person ends up in the hospital, they can actually consent to medication for them.
Obviously, there is a new administration now that is on the 5th floor of the state capitol. You've worked with Lieutenant Governor Green at times. This, homelessness was a part of one of the initiatives that he wanted to undertake as Lieutenant Governor. I'm wondering, have you had conversations with the Green administration about the role that IHS would play in their efforts to tackle homelessness, and what are some of the plans or discussions that have been had thus far?
Well, I've already spoken with their Nani Medeiros, who's their director of housing, and Governor Green has made it clear he wants to have kauhale villages, little tiny home villages for folks, and that's just one of the types of housing that could be helpful for some of our homeless individuals on the street right now. I think Nani is very clear. She wants to really develop housing at every level, which really helps homelessness in a lot of ways, because many people who are falling into homelessness are doing so who have worked, most of their lives sometimes, right? And so if we don't have affordable housing, it's very difficult for people when they're having a crisis to move into yet another place. So having housing at every level will be very, very helpful. So I think that's a big piece. The other one is that I think, Governor Green, as a physician, knows that there's so many supportive services that are needed that really help people stay in housing, especially if they've been chronically homeless, for a long time. So I think we're hopeful that the Department of Health, Adult Mental Health Division, the Alcohol and Drug Abuse Division, they'll help and really look to provide, a lot more supports, for people while they're in housing. Now, the Department of Human Services, on the other hand, has also come up, to step up to the plate, and they have developed what we call the Community Integration Services Program, which provides, housing supports for people, after they've been housed, and that is something that's paid for by Medicaid. So that's great, because 50% of that comes from the federal government. So as long as we match it, we have more money coming in, for that as well. It's the rehab option that was attached to the Medicaid program.
One thing that I think that a lot of people don't realize is that your organization and other homeless service providers have to go to the legislature every year and ask for money. And that is sort of a structural issue. Tell us a little bit about what that means for you. We had Nancy Creedman on here from the Domestic Violence Action Center on recently, and she just said that because of inflation, her core cost and then that she's seeing in other nonprofits have gone up significantly, but the funding has not. So tell us where you are in terms of the funding ask this legislative session, and what you would like to see change in that year to year.
First off, Yunji, homeless services programs that are under DHS, a lot of the programs, about 10 point some odd million of it, is not even in the base budget. So every year we have to go back to justify why we would need the money. And, I think that everybody would agree we need emergency shelters. Everybody would agree we need outreach, and we need housing, specialized housing, like Housing First, like specialized housing vouchers, maybe shallow subsidy vouchers for seniors. These are all funding that really needs to be put into the base budget, that it's assumed that it's going to be there. So we don't have to sort of like, I don't want to say waste time, kind of advocating for it every year, but we don't have to spend time, going down to the legislature. I'd much rather focus on developing programs and delivering them than having to advocate for the funding every year. I think we also need to know that homelessness is not going to go away too soon. And so I think having, like funding that is core is important. Maybe we move it around some, but there should be a certain amount of money that is just assumed that it's going to be there for a lot of the programs that we have.
When looking at what's happening on a national level, I'm wondering if you can put into perspective where Hawaii is in that mix. I mean, I know that you had mentioned that the rates overall are still up there and one of the top, I believe you said, behind New York and Washington, D.C., but this is not an issue, of course, that is confined to Hawaii. We're seeing that throughout the country. I'm here in LA and I can see a number of tents on the streets right now outside my window of this hotel. And so obviously it's something that's happened in every community. But I'm wondering how Hawaii stacks up recently when you're looking at some of the numbers comparatively to other major metropolitan cities.
I think Hawaii is actually doing pretty good. And of course, Oahu or Honolulu is the metropolitan city that we compare, ourselves, using us as a comparison. And I think overall, we're definitely building our collaborations all the time, just increasing them, all the time so that we can do a better job. I believe that better information sharing will help us. But when we compare ourselves to, say the West Coast, where a lot of this gentrification is happening, we've just had a long period of not developing enough affordable housing. And every time there is, like another proposal to develop it, we run up against what I call NIMBY, not in my backyard. And every district needs to have affordable housing. And I think people need to understand that affordable housing is not just homeless housing. It's housing for people who are working people who can't afford a lot of the units that you see right now, or they just really are not in a position. I wanted to mention that there's an ALICE report that AUW puts out, and I think I spoke to Yanji about this. The latest report that just came out last month showed that the number of people living at poverty level went from 9% to 15% over the past couple years in COVID. So we are having a problem with people being priced out and having a standard of living that is just too high for a lot of people. So the ALICE group, it stands for Asset Limited, Income Constrained, and Employed. These are working people, essentially. And it's a wide swath, but it goes up to, I believe, 60% of area median income. That group, is a lot more than should be. It's almost, I think it's 40-some% or something like that. And it's really sad that we have so many people struggling. So, it's no surprise that we have homelessness when we have that problem. I think where we have done well is homeless prevention. With all the money that came through during COVID for housing assistance, we managed to really help a lot of people avoid homelessness where it could have easily happened. But now, we have to have like a new normal in terms of who is it that really needs this funding to help prevent homelessness. Usually somebody in crisis when they suddenly lose a job or they suddenly have a health problem or something like that. That may be a time when somebody needs, some help. And so our system just needs to be geared up to be ready to help those people. And I think we do have a system that's pretty good about that. We have the AUW 211 line that people can call if they need help, and they will be directed to the right program to assist them.
Building on those numbers, when you look at that increase of people living at the poverty level in Hawaii, and you did bring up people who, you might have a car breakdown or a medical emergency, what have you. What are you concerned about who could be coming through your doors, given those statistics and the change in those demographics?
I do think that families with young children are still a vulnerable population. I think people need to know how much it costs to have children, and so that group is one that we're, expecting that we would see. Another one would be folks who are aging, and they really are, they're not a paycheck away, but say like, you're collecting Social Security, you're one bump away in rent from becoming homelessness sometimes because are homeless, because if, you're used to a certain level and your income is pretty static, that increase in rent is going to put you out, if there's no other resource for you. So, we really need to think about how we're going to help. And fortunately, there is what we call a shallow subsidy program, for seniors. And we're going to be asking for more money, I think, for those folks, because seniors are not going to be able to necessarily increase their income very easily. And, they've worked all their lives. It doesn't seem right to ask people to just work through, their retirement until they die. It just doesn't make sense to me. So sometimes having a few $100s extra will make the difference for those seniors.
Yeah, definitely. Well, unfortunately, our time is almost up. But before we end, I do want to allow you just a final message overall to viewers. Of course, this is a topic and a subject that we will continue to talk about. It will be something that we will always continue to try to find a way and solutions to address. You are someone who is on the front lines, continuing your hard work there. What do you think is the message that you'd like the community to know about where we're at right now with your organization as well as with this problem as a whole?
Well, I think with IHS, we're excited because we are going to be launching yet a new program, that is going to be about triaging people off the streets and who want to be detoxed from substance abuse. So that's one really exciting thing that I'm looking forward to. The other one is that I want people to know that it takes a whole community for us to end homelessness. So we need the community to step up in different ways. We need you to, want to welcome people back into community. We need people to support in, not just financial ways, but in in-kind ways. Welcoming people back into, like a community, a church community or activities, being willing to come into the shelters and help us as volunteers. These are also ways that really help because people need to be connected. And if you stop and think why people are homeless, it's usually because there's nobody to turn to at a certain point in their lives. So to the point where we can connect people up with folks, I think we have a great chance to just really end homelessness and reduce it significantly.
Okay, Connie Mitchell, thank you so much for joining us once again this morning and being a part of the conversation, and really just for all the work that you continue to do for this community and on this issue. We really appreciate your efforts and for giving us an update this morning. Thanks so much.
Mahalo, Ryan.
Aloha.
Thank you. Always great to hear her. She does such an amazing job in the work that she does for our community. And, what she's saying, I thought was really interesting, that there were a lot of gains made over the last few years when it comes to helping families with young children and getting those folks into more permanent situation. But the raw numbers haven't changed. There's just been a shift so that we've seen certain folks get help, but there are a lot of new people perhaps that need help as well. She talked a lot about seniors who are very vulnerable, and also about the people who are mentally ill and need the outreach assistance program that we talked about. We're going to have the mayor on here on Wednesday. We're going to be asking him about funding that program and what he sees as the future of that. That's a critical piece because those are the folks that you see that are the most visible and are often the hardest to help because they need that very serious medication. And so it does sound that this program has been successful. She's hoping it moves forward. And then Ryan, your question about the folks who are coming here from out of state, her response to that was very interesting.
Yeah, and just hearing the number that continues, of course, she said we saw a little bit of a dip during the pandemic, but how that number significantly increased over time as more and more people became more available to catch flights and flights began opening up. It continues to be an issue with some people even calling to ask to reserve beds at their facility before making that transition over. So we do know that that is an issue that will continue to have to be talked about and discussed moving forward.
Yeah, and one thing that's really interesting is what she talked about, sort of getting into the nuts and bolts of how her organization and others are funded, that this is something that they have to go to the legislature every session to ask for money that, in her estimation, perhaps should just be part of the baseline budget so that she can focus on creating programs and really delivering help as opposed to going and asking for the same funding every year. She did say there could be flexibility in how that's allocated, but really that there perhaps could be a baseline for this money as opposed to having to ask for it renewed every year, because that I'm sure takes up quite a bit of time. She's hoping to have a strong partner in Lieutenant Governor or Governor now, Josh Green, given his background as a physician and what he has stated as a priority to get affordable housing really a part of every community in the state.
Yeah, and we look forward to having a conversation with him in the future, as well as with Mayor Rick Blangiardi. He's going to be joining this program on Wednesday and continuing on in discussion about homelessness and a broad topics that we always like to go over with the mayor. We always try to get an hour. We never can maybe get to an hour, but he always asks for an hour, I should say. We always definitely fill up the half an hour. But we look forward to catching up with the mayor and hearing from him on what's happening in the city and county of Honolulu and what they're dealing with over at Honolulu Hale. Thanks so much for joining us here this morning on Spotlight Hawaii. We'll see you right back here on Wednesday. Aloha.
Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.